noticed that he was one of a handful of leaders who was instrumental in renaming cap and trade what it truly is, which is cap and tax.
Thank you very much. And I want to say thank you to those in the overflow room, too. We haven't forgotten about you. And in fact, get your questions ready because we're going to you first. But to all of you here tonight, thanks so much for taking time on a summer. It first manifested itself in that vaunted stimulus bill and the nearly $800 billion before you even talked interest that passed, that was loosely termed stimulus. And as we've all seen, as late as today, the American people are starting to get the joke. That bill is arguably only 10%, if you're kind, stimulative, and that's why we have seen very little result from its passage. We saw today, out at Clover Hill High School, 3,200 plus people come to a job fair that we had, because it's real. Every person who's lost their job is facing an economic catastrophe. That is what we're facing, and the reality is nothing from Washington, no attempt by the government is going to fix that. It is going to be all of us, it is going to be the entrepreneurs, the small business people who begin to gain confidence again and see jobs created. And it's not until we see that we can see a return to recovery. But it started with the stimulus vote. Then we got to the budget and the occurrence of more debt this year than this nation has incurred over the last 200 years all put together. At least it inched its way out of the Energy and Commerce Committee, yet to be stalled because I believe there's been so much outcry on the part of the people of this country. We cannot stand a national energy tax. And now what we're seeing is this extraordinary reach by the government, by Washington, to take over our health care. And that's really where I want to focus tonight before we get to your question. Those under 65, 70% of that health insurance comes from your place of employment. Comes from your employer. And polls have shown that 80% nearly of the individuals who have insurance think it's good. They like their health care coverage. They don't like the cost, but they think the quality is something that they want to keep. So that's why we have seen President Obama repeatedly promise, don't worry, no worries. You have got, if you like what you've got, you can keep it. Well, you know what? That is simply not the case. The other part of it. And right now, this bill has passed out of 3 committees. It is waiting for hearing in the House. And yes, I read it. The bill has provisions in there which will make it so that nearly 300,000 Virginians that are in the individual market, remember, outside of that 70% who get their insurance from their employer, people in the individual market. Basically, language deeming that type of coverage unacceptable. In this bill, 136,000 Virginians who have opted for health savings accounts will no longer be able to do that if this bill passes. And again, that's the method by which you can save tax-free for health care. That's the method by which we begin to introduce some consumerism into the mix. This bill says no. For all the folks who are on Medicare and who have chosen to go the route outside the government fee-for-service program, who've chosen a different route, and one of the plans offered to Medicare beneficiaries, this bill says you're going to no longer have that choice. Because of the desire to say, look, we got to keep everybody honest in the private sector. And in order to do that, we're going to have government compete with the private sector. It's laughable. It is laughable. But you can't, and we all know, common sense says, you can't have the government making the rules and then complying with those rules with the private sector. So it's not much of a leap to say you're going to crowd out those willing to participate in the private sector. And in fact, the national studies have shown that over 100 million Americans will migrate onto the government plan because of this very fact. And here in Virginia, 2.7 million people who have their plan with their employer will shift over into the government plan. And that's out of the 4.5 million Virginians who get their insurance there. This is what you're going to have. And we're not making it up. Believe me. This is, and here's another picture here, this is the picture diagram of what Obama-Pelosi healthcare looks like. Choices administration. This is going to be a new bureaucracy in Washington. It doesn't replace any, it is added to the existing labyrinth of bureaucracy that exists there. Specific in this bill, there is language which charges this Health Choices Administration with the task of defining what is acceptable coverage for all of us Americans. So again, going back to this notion that you can have, if you like what you have, you can keep it. Not as long as the Healthcare Choices Administrator says you can't, because this body controlled by this individual will say, and a board, will say what is acceptable and what is not. And later when we talk about how this whole program is funded, if an employer decides to offer an insurance plan that is not deemed acceptable under this plan, that employer will have one of two choices. Either go out and find a plan that is deemed acceptable by Washington, or will be taxed. Earmarked for this agency already. Right. Now what this agency is supposed to do is supposed to weigh outcomes in the healthcare arena. It's supposed to say, well, we know XYZ procedure has produced ABC results. Therefore, it's a better prescription in any given disease scenario. But remember what that is. That is a blind bureaucratic test with absolutely no clue as to what the doctor and the patient are seeing on the ground. Some third party introducing a prescription which may be or may not be relevant to the treatment needed on the ground somewhere in this country. The healthcare program for administrative simplification.